On the battlefield, soldiers are trained to identify any outward threats, whether that be enemy combatants or incoming fire. They should be able to recognize them with no problem. But what happens when the biggest threat to their health and safety comes from right under their noses? The thick, toxic smoke that came from the massive burn pits used in the wars in the Middle East exposed thousands of veterans to life-threatening illness and chronic health issues that still affect them today. After years of being silenced and this struggle going almost unnoticed, the true cost of burn pits is finally gaining attention throughout the world. With advocacy groups and affected veterans fighting for recognition, proper medical care, and overall accountability, people are finally understanding the dangers posed through this practice of using burn pits on foreign and war-torn ground. The impact of war doesn't simply vanish when a soldier leaves the battlefield. It lingers in their minds, in their hearts, and in their bodies. It plagues the landscapes and ecosystems that were destroyed in the process of war. Though it is not a perfect response, and there is still much left to be answered, the United States established the Burn Pit Registry, where service members and veterans can document their exposure, track their health, and help contribute to ongoing research efforts on the long-term effects of this deadly practice. The fight for both human and environmental accountability continues today, even after these fires have burned out. After a decade of struggle, veterans who served in Iraq and Afghanistan are finally getting the recognition, care, and aid they deserve after being exposed to the toxicity created by the burn pits they were stationed near. The United States government is committed to addressing healthcare benefits and disability compensation for veterans exposed to burn pits during their service. The Healthcare for Burn Pit Veterans Act was introduced in the 117th Congress to improve both the healthcare and services for veterans exposed to toxic substances. Its goal was to extend the eligibility period of Department of Veteran Affairs healthcare services for veterans who served after September 11, 2001, and were exposed to radiation, toxic substances, and other hazardous conditions. This extension was crucial to those who were not able to register during the original sign-up period. Additionally, the bill proposed incorporating toxic exposure screenings to the already existing VA healthcare procedures and called for annual training for healthcare personnel on issues related to toxic exposures. On February 16, 2022, this bill passed the Senate. The Veterans Burn Pit Exposure Recognition Act of 2021 was introduced in the 117th Congress to address the healthcare benefits and disability compensation for veterans who have been exposed to burn pits during their service. The bill asked the VA to acknowledge that the veterans who served in specific locations and periods were exposed to substances from burn pits. This would directly eliminate their individual needs to prove exposure. Some of these locations include Iraq, Somalia, Afghanistan, Jordan, Lebanon, and many others. If the veteran's evidence is insufficient, and for some reason doesn't quite match with the service connection for disability compensation, it is the VA's responsibility to provide medical examination and seek an opinion between disability and exposure. Overall, the goal of this bill is to simplify the process for affected veterans to receive health care and benefits by serving as a formal recognition of their exposure to hazardous and toxic substances as a result of being stationed near the burn pits during their service.